So I think what's unique about Yale Pulmonary Critical Care training is the great balance between both the clinical aspect and the academic focus.
I think our program has the perfect mix of clinical training and academic opportunities. We provide an extensive amount of clinical opportunities. We have opportunities to build a career in research, a career in medical education, or a career in other areas like advocacy, for example.
There's so many different mentors that they can work with on our faculty, and there are so many different backgrounds and clinical interests, and so they're able to get involved almost right away.
One of the most unique aspects, I think, of our fellowship program is the flexibility we try to build into the system to construct something that's unique for each individual.
I was a fellow in this program, and now I'm on the faculty. It's a great position to be in because I sort of understand the different stages that the fellows go through in our program. You know, one of the things I love about being here is that I feel that I'm constantly learning and then doing my best to teach others the things that I've learned.
Yale is, in this rich community, and New Haven is so diverse, and it's actually quite representative of the U.S. population.
We get to see a really wide range of patients in terms of socioeconomic status, in terms of medical diagnosis, in terms of racial and ethnic diversity.
We have a very extensive and diverse training program. So our fellows go through a very intense clinical training with a high acuity clinical practice here at Yale New Haven, also at St. Raphael's campus and at the VA campus. So they have different practice styles, different patient populations, but what they have in common is that they're all high complexity, high acuity environment where our fellows quickly develop a sense of independence and competency within their daily work. Then we combine that with our outpatient experience in which you are working hand in hand with these expert faculty.
So we have leaders in the field of asthma and airway disease, pulmonary hypertension, sleep, interventional pulmonary cystic fibrosis. Their clinics are essentially open to the fellows for their learning.
What ties all of them together is the educational mission.
I'm really excited about our simulation training. Within those, we have advanced and complex airway management, we have vascular access, pericardiocentesis, chest tube insertions, Blakemore insertions. All that brings together a very well-rounded clinical training in which you're not only procedurally competent, but you're also at a much elevated level of competency in terms of your pulmonary and critical care medical knowledge.
Our fellows have access to didactic sections weekly. They touch on various topics of sleep health disorders and, of course, sleep health disparities, which is also an important topic. It's just such a great opportunity for our fellows.
And that all comes together with our research. What happens is that our fellows start finding their passion and their interest in their field, and then we support that whether it is a clinical perspective or an academic development perspective. We become very invested in the growth and development of our fellows as they pursue those different career tracks. We also create an environment where they feel safe and comfortable to explore them.
What I think makes this place unique is the ability to really find who you are. Our goal has always been that commitment to help you realize your full potential.
If you're a person who loves being a doctor or a scientist or an educator who is curious and who wants to constantly learn, to constantly be challenged and be around a really motivated and talented group, this place is the place to be.